we're also seeing all of these metabolic effects. The cannabis, full cannabis, THC and CBD exposed kids had higher adiposity and higher BMI and higher fasting blood glucose than the non-exposed kids. I had this moment where I realized during fetal development, when you're being exposed to CBD and your brain's like soaking it all in, I kind of forgot that like so is the liver and so is the pancreas and so is everything else in the body. And I was like, oh yeah, those organs could also be affected.
Hey guys, my name is Shayla. Welcome to the Hey Shayla Podcast. I went from full-time travel to full-time new COVID mom, and now I'm a mom of two. And holy wow, is motherhood and adulting a learning curve. There are so many decisions we need to make and a million ways to do it right. I created this podcast to interview some of my gurus to share their knowledge and empower you on your journey. Let me be your guinea pig and ask the questions you think everyone else knows. Here, we're a little hippie. We try to do things as naturally as possible. We're open-minded, and we don't take ourselves too seriously. But above all, we support one another and work to find what works. If you're into it, you're our people. Let's get started. Hey guys, welcome back to the Hey Shayla Podcast. Today, I've got an interesting one. Today, I'm interviewing Karli Swenson. She has her PhD in physiology and her master's in maternal and child public health. She studies how different substances affect fetal development. In her work, she wanted to understand if CBD was safe to consume during pregnancy because many pregnant people take it to decrease nausea and vomiting and morning sickness. Since CBD was only legalized in 2018, the research was super sparse at the time. Over the last 4 years, they've learned an incredible amount about the potential risks, potential benefits of using CBD to decrease morning sickness. Today, Karli's going to tell us about what she's learned. We'll learn about what CBD is, how it affects fetal development, any risks and benefits, and I'm really interested to talk to her and learn more about this. Okay, I have so many questions before we even get into the meat and potatoes of what you found. So, okay, welcome. Thank you so much for coming on and chatting with me about this. First, just tell me about you and how you got your PhD in physiology, your master's in maternal and public health. Let's hear it.
Okay, so when I went into college, I knew I liked science. It was kind of unspecified. I was like, I'll dilly-dally, I'll figure it out. And I fell in love with this embryology class, which is kind of the study of how fetuses and embryos form and develop. And I took it as an elective and I was like, wait a minute, this is the coolest thing I've ever learned. And I know like all of the I don't have kids of my own, but like I know all the moms who are listening have that same moment of like I just went from 2 cells to a whole human.
Yeah.
In a relatively really short period of time.
Yeah.
Like really quickly.
Yeah.
And I just think that is the coolest thing that any body can do, and it makes no sense to me. And so I don't know, I really was fascinated by it. And so when I got close to graduation and I was having that, what career do I want?
What are you gonna do after college?
Yeah, the most stressful question to get when you're like 21. And I was like, I don't know.
Yeah.
I think pregnancy is cool. And everyone was like, okay, that's good.
Neat.
And so I ended up deciding to go to grad school. So I went to college in Wyoming and then moved down to Denver. I went to the University of Colorado at the Anschutz Medical Campus, which is an awesome academic medical center. You really have access to anything that you need in the science world.
Cool.
And so I got into a PhD program in physiology, and most people have no clue what PhDs are. I learned partway through that because I also didn't totally understand it until I was in it. So a PhD is a research doctoral degree. So we have our doctorates, but we're not medical providers.
Right.
And so we do all sorts of research all the way on the super, super preclinical level, working with cells and animals, to clinical research, working with patients, like clinical trials, and then all the way up to like population-based studies where you have thousands and thousands of people that are totally de-identified and you're just working with numbers, basically.
Interesting.
Um, and so I was in the physiology program and I knew I wanted to study something fetal development. And fetal development in itself is so cool, but also studying what can go wrong in fetal development, I thought was really interesting because things do go wrong and you want to be able to have the literature on how they go wrong, how you could potentially intervene when they go wrong, like how we can help patients when things do go wrong.
Right.
Um, and so I ended up finding kind of my home in the lab that I was in, and my boss at the time was pretty flexible. And she was kind of like, if you find something you really want to study and we can get it funded, let's tackle it. And I was like, okay, cool. And that was in 2019. So it was right after CBD was federally legalized and was officially made available at like gas stations, grocery stores, Whole Foods, pet stores is a big one.
Oh,
Um,
wow.
and because it was then so widely available, it was like essentially kind of started gaining traction as this wonder drug where it was gaining research expertise. So CBD at that time was starting to get traction in like pediatric seizures. So Epidiolex is FDA approved for kids with very severe pediatric seizures, which is
What's that?
awesome. It's the
Epi-
first CBD product to be FDA approved
oh,
for
I see.
medication.
That's wild.
Yeah, and it's incredibly useful, and so then it started gaining traction in, chemotherapy. So there's been a ton of work in how CBD and THC, which is the other component of cannabis that kind of gives you the high that's associated with cannabis or marijuana or whatever we wanna call it. Um, and so people were studying it for people who have cancer and were in chemotherapy, how it decreases their pain and decreases the nausea and vomiting from their chemotherapy drugs, and how it can really improve quality of life,
Mm-hmm.
which is awesome. And it's so, so important for those patients. Like it's such a breakthrough in that scenario
Mm-hmm.
and in many other scenarios. But there was kind of this idea that now that it was becoming a medicine and you could buy it at Whole Foods,
Yeah. They're
everyone was like,
safe.
this is the wonder drug.
Yeah.
This poses no risk. This is totally safe. And we were kind of like, whoa, we don't know that. Like we don't have any data. There's no data to show safety or harm. Like it's not that it's not safe or not harmful. We just don't know.
Right.
Which is such a weird spot to be
Totally.
in when you're trying to talk like actively pregnant patients. At the time, my boss was pregnant and she had really severe morning sickness. She had something called hyperemesis, which is when you have morning sickness like
Always.
right through
Yeah.
pregnancy.
Horrible.
And she had people literally, she would get sick at the grocery store
Oh,
and
man.
people would be literally handing her CBD products and being like, you should do that. Like, this will help. This will help. This will help. And of course, like any rational human being in that moment, you're like, will this help me? Like, I feel
Uh,
horrible.
100%. Yeah. Okay, wait, before we
Yeah.
go further, will
Yeah.
you discuss, because I feel like it's two-sided. So
Yes.
first, I think when it was legalized,
Mhm.
yes, wonder drug, but also like it was at Whole Foods. So you're like, oh,
Yeah.
this is
It's
like
just
a
a supplement.
vitamin. It's super
Yeah.
chill, like no
It's
big deal.
literally in the supplement aisle.
Yes. But on the other hand, I remember my dad because I think he had like back pain or something. And that was me. I was like, Dad, you should try CBD, see what happens. Or people were recommending it. And he was like,
Yeah.
Kayla, where can I get some CBD? And
You're
I was
like,
like,
good question. I don't know.
Dad, literally you could order it on Amazon. And he's like, well, you do know anyone that could like get me some CBD? I'm like,
The internet.
it's not a drug, Dad. It's not like marijuana. Like he was trying to get me to be his
It's just part
dealer or
of it.
something.
It's just
And
part
I'm
of it. Yeah. No,
like, I don't know what
that
you're
was
talking.
such a pervasive belief for a while there because also like all of the cannabinoids have really similar names. And so a lot of people so to give a little like
Yeah, give us the very
kind of into it.
layman term or
Yeah.
layman understanding of.
Yes. So cannabis, which is the plant, also called marijuana,
Okay.
has many, many compounds in it, and they're all called cannabinoids. It's just a compound that's in the cannabis plant, basically, is how they
Okay.
got that name. And they have a whole bunch of different acronyms, and the ones that most people are familiar with are THC, which when you ingest it, however you ingest it, it crosses this thing called the blood-brain barrier, and it can get into your brain, and that's how it causes the high that's associated with getting high from marijuana or cannabis. And then there's other compounds like CBD. You might have heard of CBG or CBN. Some of those are like starting to gain traction right now, but there are all these other
Never.
just minor cannabinoids. They've been in the plant for many, many years. It's part of the plant. Um, and a lot of people who are familiar with cannabis have been told about like the different strains of cannabis and how some get you really high and some give you a body high and some are a brain high and all of that.
Yeah.
There's that science is a little iffy because the plant has been inbred for like thousands of years, so there's the strains are debated, but
Okay.
basically it's the different levels of like how much THC to how much CBD is.
Oh, interesting. Okay.
And so THC, like the actual compound of THC, is the one that's federally illegal, but legalized in many states.
States,
And
yeah.
then CBD in 2018, um, I still have some beef with this, and it's because so the federal government in 2018 released something called the Farm Bill, and that basically regulates like production and sales of all of these different plants, essentially. And so they descheduled CBD. It used to be Schedule 1, the highest tier, just like THC is, along with like I believe methamphetamine is
Oh,
Schedule
wow.
1. Like it's up there.
Yeah, right.
Literally as high up the list as you can get. And so they descheduled it, but there was a hook on it where they said they specifically their verbiage was that they descheduled hemp-derived CBD, which does not include synthetic CBD, which is what a lot of companies sell and also what you can get from the government. So that was very frustrating. There were some legal loopholes we ended up having to jump through, but
I don't even understand what that means. You can
hemp-derived because it
synthetically
comes
make,
yeah,
okay, so you can synthetically make CBD.
yeah.
Are there CBD plants that are without THC, or do you need to do some sort of,
So you can extract it
yeah,
from plants that have other compounds in it. It's very like a very pharmaceutical approach. So you can extract it and purify CBD from plants that have all sorts of other things, but you can also make the compound of CBD just like how you would make the compound of Adderall or
okay.
whatever pharmaceutical you're taking in a bottle.
And you can also just have a CBD plant?
I think so.
Okay.
I'm
We
sure.
don't know for sure. Okay. But
CBD
typically it's synthetic or it's extracted.
hemp derived, yeah, from the plant
Hemp
itself.
derived. Is hemp the same thing as
Hemp's the plant. So if you hear
like
like hemp
cannabis, hemp,
fibers,
marijuana,
mhm,
all the same? Okay.
yeah, like you can buy hemp bags. A lot of
Right.
people are really into the hemp lotion, hemp balm,
Yep. Yep.
that kind of stuff. Yeah, but you can extract CBD from all those things.
Okay.
Um, which was annoying when we were trying to source CBD for our research, when it was like you can legally have hemp derived, but we couldn't source hemp derived. So we actually spent 16 months getting a Schedule 1 drug license from the federal government to study CBD. And I was like, I can go to 7-Eleven on campus. I can go to 7-Eleven, buy it and take it, but I cannot study it because it's illegal federally.
Whoa.
Yeah, that was the most annoying
Yeah, that's
16
so
months
weird.
ever. Yeah, and you can't get funded until you like have the
Right.
license to have the drug. So we were basically sitting there like twiddling our thumbs,
Just waiting.
just waiting for
Okay.
them. And it was COVID, so like it took forever.
Oh my gosh.
Yeah.
But so what made you say I want to see if CBD what just the timing of like CBD coming up and you looking at fetal
Kind
development?
of. It was mostly because so I wanted to study something related to pregnancy, and one of the most common debilitating symptoms is morning sickness. And people, I I haven't had them myself, but I do have so much empathy for people. I like that they call it morning sickness, even though it's like such a misnomer. Like that
Yeah.
is an all day
Yeah.
thing. And
Yes.
I just have so much sympathy for the person who's like laying on their bathroom floor at 2 in the morning, hugging a toilet for like the fourth week in a row,
Yeah.
just miserable. And at that point, like, I feel like there's a point of desperation that you hit where you're just on your
Totally.
phone Googling, like, can I do this? Can I do this? Will this help me? Will that help me?
Yeah.
And at the time, there was this big influx, partially on social media, partially on, like, the the rest of the internet, like, on Facebook and TikTok and all of that stuff, but also on, like, Google, um, that was saying, like, "Nope, cannabis is totally safe, 100% safe." Like, these are all anonymous accounts, obviously, but it'd be like, "I'm a nurse, you're totally fine, there's no legal repercussions, like,
Yeah.
my doctor told me to do this, this is how you can avoid, like, prosecution
Oh
because
my
it's
gosh.
legal." Because it's a federal one, cannabis as a whole is still a federal Schedule I drug. If you test positive at labor and delivery units, depending on your state, that's an automatic CPS referral.
For
Like,
cannabis or
that's
for
an illegal
CBD?
drug. No, for cannabis.
Oh.
Cannabis is
Got it, got
yeah.
it.
So at the time, I was wanting to study cannabis,
Yeah.
and in Colorado, I was like, "It's legal.
Yeah.
I should be able like, this should be easy." And then, it turned out it wasn't easy, so I was like, "I'll do CBD." Like, CBD's new,
Got it.
it's hip, it's, like, less stigmatized,
Yep.
and it's now at Whole Foods, so, like, this
Yeah.
is gonna be so easy. And then it took the 16 months,
Right.
and I was like, "It's not easy."
So then once you decided that you were gonna do it, then how did
How do
you
you do
do
it?
it? Yeah.
So, I work in preclinical research, which means I work with cells and animals instead of
Okay.
people. So, with people in general, and especially with a pregnant population, there's so many ethical considerations. Like, it's totally unethical to have this drug and know there could potentially be risk. I'm going to randomize pregnant patients to taking it.
Yeah.
Like, no board is going to approve that without
Right.
the possibility of extreme benefit. Like,
Right.
that's not gonna happen. So, all of my work was preclinical, which means basically we had all of these colonies of mice, and we would set them up with males, and they would get pregnant, and we would m it's called plug checking. You have to, like, set the mouse up with a male mouse and then leave them overnight and then go look in their hoo-ha in the morning and see if there's sperm in it.
Oh my
And
gosh.
yeah, that was fun. Uh,
Love
for,
it.
like, hundreds of mice.
Yeah. Oh my gosh, that's amazing.
Yeah, and then you take the male out, so now you have this little female pregnant, early pregnancy mouse. And mouse pregnancies are pretty similar to humans translationally, but they're really quick. So mice are only pregnant for 3 weeks,
Oh wow.
and then they pop out their pups, and they usually have about 8
Oh
pups.
wow.
I know. Yikes. And what we would do is so CBD, there's a lot of the prior literature was doing like injections and things like that. And we're like, well, no human is out here
Injecting CBD.
injecting CBD. Like that's not something that's gonna happen.
Right.
And so we wanted to and the way that the drug is metabolized is super different. So similar to like other drugs, you're gonna feel very different if you orally ingest it, if you snort it, if you inject it, like, it can be
Hmm.
the same thing, but it's gonna make you feel really differently, and with cannabis, a lot of people are familiar with the difference between, like, smoking cannabis and taking an edible. Like, smoking will get you high really quickly, and then it peters off very quickly, but edibles take a lot longer to set up, and then they come down slower.
Okay.
Very similar with CBD, just the way it's metabolized in the body.
Right, but you're not
And
feeling
so I was
high.
like yeah, and so I was
Right.
like, injections aren't the way. Also, I, like, don't feel like injecting mice every day.
Yeah.
Um, so we decided to do something called an oral gavage, which is like a little kinda like a little feeding tube that you give the mouse. It's and so we took the CBD, it finally came from the federal government in all of its lock boxes.
Oh my gosh.
It's really fun. And we dissolved it in sunflower oil. We just Googled like CBD products and found that a lot of the oral solutions were in sunflower oil, and we're like, okay, we'll do that one.
Okay.
Um, and so we dissolved it, and then every day I would go down and I would weigh the mouse, and because she gains weight during pregnancy, and I would give her this one standard dose of CBD with the little feeding tube. So it's kind of like if she had had an edible
Yeah.
comparatively.
Right.
Uh,
Metabolizing.
and then you do that all the way through their pregnancy, and then they give birth, and you let the pups, they breastfeed per normal, and then we separate them from their moms once they're, like, weaning age.
But you didn't do CBD during breastfeeding.
They do not do CBD during breastfeeding. However, a very interesting little caveat that not a lot of people know is so CBD and all the other cannabinoids, those molecules are all based on their structure, really fat soluble. They're not water soluble. So when you think about like alcohol, you pee out alcohol because it's water soluble,
Okay.
but cannabinoids are fat soluble, which means when you consume them, they store in fatty tissues. And breast milk happens to be like the best fatty tissue that's ever existed.
Okay.
And so the only studies I've seen have looked at THC and CBD, but both of them have shown that actually when you're consuming THC or CBD while either breastfeeding or right before delivery, when you're starting to build those breast milk stores, it not only goes into your breast milk, but it actually accumulates in breast milk because it's like this is the best fatty storage place. Like we're all gonna go.
Whoa.
Yeah. And there was some weird issues. This is like such a caveat, but I find it really interesting. There was a lot of issues where at some of the breast milk banks, you know how people who have like
Donate.
oversized
Yeah.
can donate, they test all the breast milk for everything, right? Because you
Yeah.
want it's clean. And they were getting almost no cannabis positive breast milk. And they were like, cannabis consumption rates are very high.
Yeah.
This doesn't make any sense, and it turned out that they were using the same test you would use on a urine drug screen on the
Uh,
milk, but urine gets the water-soluble metabolites and not the milk-soluble metabolites. So then they went back and started retesting the milk, and, like, a ton of it
yeah.
was cannabis positive, and they were like, "Oh god, we
Oh
need to"
my
they had to
gosh.
change, like, all their protocols.
Yeah.
I'm glad they figured it out.
Yeah, right. No kidding.
But it was kind of a funny moment where we were like, we need to keep in mind how this drug
Totally.
works. But
Interesting.
there's the concern, like if you're consuming all the way during your pregnancy, when you're putting on all that fat as you
Mm-hmm.
have to carry a pregnancy,
Totally.
you're storing cannabinoids in that fat buildup, and then you have the baby and you're breastfeeding and you're burning all of that fat. There's this hypothesis that you're actually liberating a lot of those cannabinoids back into your bloodstream as you're burning that fat, and then it goes through the breast milk and can be detected in baby's bloodstream.
Oh, which
Yeah.
who know, but that's what your research is like. Is that a bad thing? Like I
Like, does it
gasp,
matter?
like, oh my gosh, that's
Yeah, exactly.
is it bad
Exactly.
or not? Right. Okay.
Exactly.
So let's keep going. So
Yes.
you
Okay.
give it
So
to them all through their pregnancy, but
we
not
give
in
it to
your
the mom.
study, not during breastfeeding.
Not during breastfeeding and
Okay.
not before pregnancy. And so then the pups are born and you let them grow up a little bit and then we run them through like the stereotypical science thing where it's like a mouse in a maze.
Yeah.
That's the cheese part. The cheese is fake. There's no cheese involved, but there are mazes. Lots and lots of mazes that lots and lots of researchers have figured out like this maze specifically tests cognition and this maze specifically tests anxiety and this maze
What?
memory. Yeah, there's like a bajillion mazes
That's bizarre.
kind of that you run the mice through. And so what I went into this, so what the literature showed before I started was that the effect of cannabis, like full cannabis, THC, all of it, from clinical studies, retrospective clinical studies, which means people consumed cannabis during their pregnancies as much as they wanted, whenever they wanted, like there was no standardization, but they just reported that they were taking it
Which
to the
gets rid of the ethical problem, right?
which gets rid of the ethical problem, but there's no controls.
Right.
So you're like,
Right.
I
So they
have
might
no
be taking it
idea.
once a week, one time
Yeah,
during their pregnancy, every day.
exactly. And
Yeah.
you have to go on what they say, but there's even if you're a researcher and you're like, I am not a doctor, I cannot report you to anybody, like I am simply a researcher, there's still that bias of like,
Totally.
what if you do? Sort of thing. So even then it was underreported compared
Yeah.
to like when we took blood and urine and people who said that they weren't clearly were. Uh,
Mm.
but those studies, they followed those kids for I think those kids are like 8 or 9 now, but the most recent published data was from when they were 5.
Okay.
Um, and that was showing that in utero cannabis exposure was causing anxiety in these kids and ADHD, sometimes compared to their non-exposed siblings.
Oh, wow.
Yeah. Um, but the mechanism wasn't figured out yet. We were just seeing all these correlations between the kids that were exposed compared to kids that weren't. But we didn't know, is that THC? Is that CBD? Like, is it
Mm.
the dose? Is it the timing? Was there a critical window during pregnancy?
Oh my
We're not
gosh.
sure.
Yeah.
And so that's also so hard when these patients are pregnant and they're coming in saying, like, is this okay? And the doctors are like,
Yeah.
no, no,
Yeah.
I don't think so. Like, this is all the data we have. So,
Right.
like, TBD. And so what we wanted to see was if CBD was causing a lot of those behavioral effects. So we were doing the tests for anxiety and memory and cognition and all sorts of other stuff.
Right. So
Um,
sorry, real quick,
yeah,
just to summarize what you've just said. So the studies were for full cannabis, like somebody just smoking
well,
weed.
somebody smoking weed and
And
following the
it's
research that they're doing it.
and yeah, and just reporting that they're doing it, but it's very uncontrolled, which then led to anxiety, ADD. But you're like, but what was that exactly? So you pulled the one compound of CBD to be like, maybe it's this. Let's
Yep,
check this out, see if this
for
has
sure.
anything to do with it.
Yeah.
Where you could have pulled THC, or you could have started doing the dosage or checking, like you said, the critical periods at first
Mhm.
trimester, is it second? Okay. All right, we're going to take a brief break to talk about the viral frownies that you see all over Instagram. It's supposed to be the non-toxic version of Botox. And essentially what it is a cast that you put on. I put it on my forehead. And so it just like makes your muscles not move. And it's supposed to train your muscles not to move. I wear it at night. Sometimes I wear it when I'm working. Anytime I'm in a scowl, I don't really care too much about like the crow's feet or the lines across my forehead. I have this butt crack right in between my, some people call it the 11s. It's probably more appropriate. Mine's just one though, so I just don't want to call it the one. So I call it the butt crack. I would recommend. I say it's like working out. So if you're consistent with it, it will work. If you're not consistent with it, it won't work. And I know that because I've been not consistent with it. And I noticed that my butt crack comes back full fledged. So I'm back on the train of being consistent with it. So if you've seen these and you've wondered if they work, I would say yes, if you are consistent. And if you want to try them, you can go to heyshayla.com/frownies/POD and you can use Hey Shayla as a discount code. Let's get back to the show.
So the first study we did was high dose. It's called it's 50 mgs per kg, which is just like way higher than a normal human would
Would
take.
take.
But we
Okay.
wanted to go high and see what we find. Because if you
Okay.
go too low and then you don't find anything, you're like, I don't know if there actually
Yeah.
was anything there. So we started with a high dose just to see. Um, and we ran them through these tests, and I was really excited that there wasn't any changes in anxiety or ADHD. We didn't specifically look at ADHD, but there was no changes in anxiety, compulsivity, which is like one of the factors of like OCD,
Okay.
how compulsive mice are. And we didn't see any changes in memory. And I was like, oh my God, is this a wonder drug?
This
Like,
is the miracle drug.
is
Yeah.
this gonna be perfect? Like, I was so, it was kind of hard because it was negative data, which is really hard to publish. But I was like, this is awesome. Oh my God, we're doing so well. And then we ran this test of cognition. And unfortunately, weirdly, there was a big sex difference. So the males were totally fine. And we were like, okay, that's fine. But the females had really difficult times completing this cognitive challenge repeatedly, like different mice multiple times. The females were not meeting these cognitive markers compared to
Hmm.
the mice. And I forgot to mention, we had this whole doubled group of control mice where they had the same handling every day by the research team. We were totally blinded to which group was which. So they were getting just sunflower oil as a
Okay.
control.
Oh, I see.
And during this time, we had no, like me as a researcher, I had no idea which group was which to decrease bias.
Right.
But the females that were CBD exposed were having all of these problems. And we're like, that's really interesting. We hadn't looked at cognition in the clinical population. So I was kind of like, maybe it's a fluke. Like maybe we'll see where it goes. And so we partnered with this other lab on campus that's a neurodevelopment lab. And what they wanted to do was look at a part of the brain. It's called the prefrontal cortex. It's like right here behind your forehead. And that's where personality and thinking, like that's really what makes you
You.
you, kind
Yeah.
of, is the prefrontal cortex. And that's also where cognition kind of lays. And so they wanted to look at the brains of these mice and see what was going on in the prefrontal cortex. And they looked at the males and the females that were CBD exposed and vehicle exposed. Vehicle is just the sunflower oil. And they were also blinded. They didn't know which group was which. And the males, just like in the cognitive studies, had no differences. The males were chilling, like they were totally fine. But the females, they saw that the neurons in the prefrontal cortex from the CBD exposed mice had much more difficulty communicating with each other. So in your brain, when you have one neuron, it has to talk to another neuron by sending this thing called an action potential. And then that kind of trickles down to get to where you need to go, basically. And these mice, it took a lot more to get them to elicit an action potential, like to get one started or to respond to an action potential. They had a really difficult time doing that. And it was funny because my friends who were running those experiments were like, I'm blinded, but I have a theory as to which one's which. And I was like, yeah.
Did they know your outcome?
Yeah.
Did they
But
know when they started studying, did they know that you found that the female CBD?
they did.
Okay,
Yeah,
so they were
which is
kind of
why we
like,
started partnering with them. And then when one group was lower, they were like, and they finished their data collection. They're like, so is this one the CBD group? And I was like,
yeah,
yeah, that
yeah.
one is the CBD group.
Okay, so what
So
does that look like? Like slow cognitive function. I understand like my elective class in college was neuroscience, and I was just like, this
perfect.
is so good. Like I loved it. I didn't do well. I think I got a C in the class, but I could care less about the C. I was so fascinated. But okay, so you're saying the neurons and the action potential, but what does that look like in a human to have low cognitive function?
So it's hard because we can't do a direct comparison with humans because we can't like slice a human's brain and then
Okay.
watch it, if that makes sense. But when your neurons are communicating less to each other, you have less overall action potential activity. So there's this thing called an MRI or a fMRI. It's a functional MRI that you can go in and it can look at the activity of a human brain. Like how have you ever seen those pictures where it's like when you see this image, this area of your brain lights
Yeah.
up, like that
Yeah.
kind of stuff? That's kind of as close to we can get as humans, like what we're doing in these mice. And it would basically say that when in a normal situation, when you would have this much activity going on in the prefrontal cortex, if you were CBD exposed, you have dampened that activity. You don't have as much.
But I
And
mean, does that look like you are tripping more, or you can't think of words fast enough? Like,
kind of, yeah. So most of the and so in mice, we have the brain stuff. The cognitive skill is like a challenge. So
okay,
you repeatedly show these mice to a challenge, and once they've seen it once,
they
and then
should.
they see it again, they should know how to
Okay, this is what I'm
it,
asking. Yeah,
and they don't. Their time stays the same to complete the task that
got
they've
it.
already seen.
So
And if
they have a harder time like learning.
they have a harder time learning. And
Okay,
so there's a bunch of different ways you can look at that in humans. A lot of them are surveys, a lot of them in kids. It's like, we've taught you how to braid the rope. Can you braid the rope? You've braided the rope. Can you braid it again?
okay,
Like that kind of is
okay.
kind of the most
Yeah,
translationally relevant.
okay. That makes sense.
Yeah. So that was kind of one of the biggest findings that we had was this change in cognition in the females that were exposed, and that it wasn't kind of a fluke, and that actually their brain is signaling differently. And so what we did after that, what we were looking at, so that was at high dose CBD every day during pregnancy.
Right,
But
which is
then we
low.
did something called a dose response. So instead of giving 50 mg per kg per day in this next big cohort, we did 3 different doses. We did 50 mg per kg per day, just like we had, 25 mg per kg per day, and then 5 mg per kg per day. And 5 is like a very translationally relevant dose, like something you could easily consume if you were buying CBD at Whole Foods.
Oh,
Everything.
5 would be what like a typical person would.
5 is much more relevant to
Okay.
what a human would consume. And the data is not published yet, but we saw essentially the same thing in those mice.
So then what would be the next step? That what
And
yeah.
then what we did, so those mice are all growing up, and I defended in September, so I haven't been back in the lab, but the people are the rest of the people in the lab are like still actively doing these studies as the mice get older. So we did the dose response, and we really liked that 5 mg per kg dose because we were like, we're still seeing effects,
Yeah.
and
Is it still just with the females?
That one was. And then I
Okay.
have this whole I'll tell you about, like, the kind of the whole other side of the story, which is hard because it's not published yet, so it's like, it hasn't gone through peer review, we're still collecting some of the data, but we're also seeing all of these metabolic effects, which is basically, like, the mice that came out at this high dose, the 50 mgs per kg, um, we to give you, like, the brief story of how we even started looking at that, we had looked at this part of the brain, and we thought we were gonna see a lot of changes in the genes, so, like, the things that, um, code for everything that goes on in all of your cells. We were looking at all these pathways of all of these genes, and we thought we were gonna see all of these neurodevelopmental genes come up and the most changed. And we didn't. We actually saw a lot of changes in metabolic pathways, which is like how you use glucose, how you respond to insulin, like everything you
Hmm.
think of when you think of like diabetes.
Yeah.
Those genes were super different. And we were like, okay, that's weird.
Unexpected. Yeah.
Like, why? And we went back to the literature, and right as we were doing that, a new study had been published from that clinical group of those kids that were growing up that were 5 years old, and it showed that the cannabis, full cannabis, THC and CBD exposed kids had higher adiposity and higher BMI and higher fasting blood glucose than the non-exposed kids. And we're
Okay.
like, huh, is there a metabolic effect here? Like, what's going on? And we're like, well, we have the mice. Let's test it. Like, let's rule this out. And so when you have to do your glucola drink, like
Mm-hmm.
that we did that on the mice, essentially.
Okay.
You
Okay.
give them glucose and you see how well they respond.
Yeah.
And they failed it. They all failed it. The CBD mice were super glucose resistant, and we're like glucose intolerant. And we're like, that's weird. And we're like, maybe what if we give them insulin and see if they respond to that? Are they resistant to insulin? So we gave them insulin, and they were resistant to insulin. And we were like, what in the world is going on here? But they had the same body composition. So they weighed the same,
Hmm.
and they had the same amount of fat and the same amount of muscle.
And no difference in gender.
No difference in gender. Just all of the CBD mice were showing this stuff. And we put them in this thing called a calorimeter, which measures like how much they breathe and how many calories they're burning. It's like this weird little enclosed box.
Wow.
And it showed that the mice were acting totally the same. And I'm a brain behavior person. So I was like, if these mice are glucose intolerant and insulin resistant, like they're probably eating more and moving less. Like that would make sense. But we measured it and they weren't. And we're like, okay, so they're not acting any differently. Like they're acting the same.
Yeah.
What's going on? And then I had this moment where I realized that I'm such a brain person, but during fetal development, when you're being exposed to CBD and your brain's like soaking it all in, I kind of forgot that like so is the liver and so is the pancreas and so is
Mm.
everything else in the body that's also a fatty
Right.
tissue CBD loves to go into. And I was like, oh yeah, those organs could also be affected.
Yeah, right.
Right.
Just looking at the brain here, but yeah.
And so those studies are like finally wrapping up. We're trying to get it published, hopefully here shortly. But classifying the glucose intolerance and insulin resistance that follow the high dose.
So then does that mean diabetes?
Kind of. It's like diabetes is hard to measure in a mouse
Okay.
because it's kind of like a clinical phenotype, but it's kind of like as close as you can get to this mouse being like a diabetic mouse.
Okay.
Yeah, but
Hmm.
the same like high blood sugar, like all of that is the same in the mice as it is in like a diabetic human.
Okay.
And so when we did that dose response, so that was at the 50 mgs per kg, and then we did the 25 and the 5, and the 5 actually showed worse effect on the metabolic outcomes. Right? Yeah,
What?
that's the face I made where I was just like,
Yeah.
possible? Like what is going on? And when you think about exposures, you're like more is worse.
Right.
Obviously, like that's how drugs work. And then I as I was going back into the literature, I actually think it's more of kind of like a Goldilocks situation where if you give too much of the drug, maybe you're shutting down a whole pathway. Maybe you're like
Hmm.
telling these receptors that there's way too much going on and they're downregulating themselves. Who knows? But maybe at this low dose, you're at that perfect window of like activating the receptors enough to cause a change without shutting
Turn
them
them
down
down. Right.
by working
Interesting.
too hard. So we were like, that's bizarre.
Yeah.
Okay. So we kept going with this 5 mg per kg dose. So we went from high dose all the way through pregnancy. We repeated it with the low dose, and we're like, okay, this low dose is where we want to stick. And then the most recent studies that these mice are like, they're young now. They're probably only a couple months old at this point. But then we wanted to do a windows of exposure. So we were looking at that low dose of 5 mg per kg of early pregnancy or of late pregnancy, and then run the same tests and see if there's any changes. And unfortunately, I don't have that data because we're still
Ah,
still collecting it.
so interesting.
Oh, to see if it's like, what if you do low dose during late pregnancy? What if we don't see it there? We're not sure because we're still collecting it.
Right.
But I'm still approaching it with this like, I wanna be able to rule out something to be like, maybe it's safe during this
Yeah.
time. Like, I
Yeah.
would love to be able to say that because
Yeah.
it's so easily accessible, and it like the hardest thing with CBD is that it works really well. It's a very effective antiemetic, which sucks.
Yeah. Right. Right.
Like, it's hard because it's like that cost benefit analysis. If it's
Right.
something that's not helping you, that poses risk, it's really easy to stop.
Hmm.
But when you have really severe morning sickness and this works, it's the barrier is much higher to
Totally.
potential risk only in mice, but also we can't test it in humans,
Yeah.
so we have to go with the mice. So it's very
Yep.
much so a like a person to person decision. And one of the reasons I actually, so I was in the PhD program, and I was really enjoying it. That was all the mouse stuff. But during that time, a lot of my colleagues that I would interact with who are very basic science people, I would be presenting this data and they would ask me a question at the end and they'd be like, so you showed that this drug at this dose causes harm. Ergo, anyone who's using this is like clearly a bad person. And I had some people who would be like, this is why that this should be illegal again. And I was like, whoa, whoa, like that is
Yeah.
so not what I said.
Yeah. Right.
Well, I go back through my slides. Like I never once
Yeah. Well, that's
went
like,
ah,
what is that? Ibuprofen? I'm not allowed to take ibuprofen,
uh-huh.
but like, that doesn't mean that we should make it illegal for the general population to not be able to take ibuprofen.
Yeah, yeah, and it was like this moral assignment that they were giving to
Oh,
people, and I was like, "Hang on, this
yeah.
is new research that at that time wasn't published yet, so how would they know?"
Yeah.
No,
Right.
like, there's probably 5 other labs that I could name that are also studying
I was going
in
to ask you
neuro
that.
exposure. Like,
Yeah.
it's a small world. Like,
And are they finding similar things?
they are finding really
So,
similar things, which
but
is
there
nice that
was
it's, like, repetitive.
consistent. Yeah.
Yeah.
But
Um,
there was in Europe, I remember learning this in college. There was like a anti-nausea drug that was causing like,
thalidomide.
yeah, like babies to not have
Horrible thing,
limbs. Yeah.
horrible. Yeah,
Right.
thalidomide was a tragedy.
Right.
But there was people I actually did have people compare it to thalidomide, and I was like, "Okay, whoa."
But I feel like it's the unknown of exactly what you're saying. This is helping me so much and the cost benefit. And you
Yeah, who
just don't
knows?
know yet, right? Until you know. And then clearly, once you know, you're not going to do that. And so
Yeah.
your whole thing is, let's figure that out. All right, we are going to take a brief break to talk about expecting and empowered. If you follow me at all, you're like, Shayla, stop talking about them. I can't. I won't. I will never. If you are pregnant or you're postpartum and you want to work out and you need a guide, this is your guide. These women are women's health physical therapists, a nurse. They give you a step-by-step guide through your entire pregnancy for what is safe to do. So you don't have to wonder. You don't have to worry about you're doing the wrong thing. There's an app. It does pelvic floor work, which I had no idea that was even important. It's crucial for preparing for labor and repairing from labor. And then your workout, and then core work. And core work when you're pregnant is not crunches. So it just teaches you the way to do things. They have a running program, they have yoga, they have all sorts of stuff on their app, and they have postpartum. So I have been using this since I was pregnant with my first. In 2019, I am just a huge advocate of them. Highly recommend. Hey Shayla will give you a discount on their app. And you can go to heyshayla.com/expecting an empowered pod. You're welcome.
Like, we have to for people to make an informed decision with their pregnancy,
Right.
they have to know the risks and the benefits.
Right.
And to do that, not only do we have to study it to know the risks and the benefits, but also in science, we suck. We suck at talking to other people. Like, academics are really good at writing up all their data in a very academic manner and then publishing it in a journal that's very academic, that is behind a paywall so normal people
Right.
can't access it, which is
Yeah.
really cool. And then talking to all of their colleagues in a really academic manner and being like, "We did it." And
Right.
it drove me crazy. I was like, "Who frankly, who cares
Yeah.
if this mouse did this one thing, if we never talk to our OBGYN colleagues, like, if we never talk to the public, if we never talk to public health people, if we never talk to clinicians,
Totally.
who cares?" Like,
I love that.
it drove me crazy, and so that's when I started picking up the, maternal child public health stuff, and all of my work in that was less so cannabis focused and more so, like, perinatal substance use in general. But it was so refreshing when I was like, we are talking to actual people who are making actual decisions with the information
And
that they
recommendations.
one of the
Yeah.
things that it's also not published, but it's just kind of like a side project that I'm working on. I'm looking at how perinatal cannabis use or cannabis use during pregnancy is portrayed online, like trying to quantify it. So if you were, say, well, I guess you're what, 18 weeks now?
Yeah.
Congratulations.
Yeah,
Hopefully the
thanks.
morning sickness has
I didn't
faded.
really get that much this
Oh,
time, but I'll
I'm
tell
so
you a
glad.
story later, but
Yeah.
keep going.
Say you're like 10 weeks pregnant and just having an awful, awful time, like the laying on the bathroom floor
Yeah.
situation. And you go online. I was like, I want to know what I would find if I was that person. And so I went through and
Girl,
this
you are
whole thing,
good.
it's fun. There's this whole thing called Canamommy TikTok, Canamommy Reddit, Canamommy Instagram. There's Facebook page. There's a
Oh,
whole app. There's a whole app for like Canamommy stuff. And everyone unanimously was saying, "This is totally safe. There's no effects. You are totally fine. Here's how you avoid a drug test. Like, don't worry about it." But then these patients are like, "Okay." And it's a when you're miserable and you want to find something that agrees
validation.
with what you want. Yeah,
Yes,
you want the
100%.
validation.
Yep.
There's like the entire internet is your validation. But
Mm-hmm.
the thing that will not blow up on TikTok is the CDC being like, "Hey, there are potential risks. Weigh the risks and benefits with your provider." Like, that's
Yeah.
not gonna get any traction.
No.
And so like, that information is just not findable, and all of the published literature is behind these paywalls, so they can't access it.
That's what I was going to ask you. If somebody wants to learn more about this.
Yeah. Thankfully, a lot of the journals are moving towards something called open access, which means basically the researchers this is such a messed up system. You think when you do research and you submit a paper that you, like, get paid for the work that you did? Researchers pay journals to publish their research, and yeah, it's really well, it has to go through peer review and get accepted, but
Yeah.
you have to pay fees, like, upwards in the thousands of dollars, depending on the journal. Mhm, mhm, and to publish open access, like, one of the recent papers we published that was on the cognition stuff, I think it costs, like, over 5 grand to make it open access, so people who Google it can read it. Yeah. Isn't that fun? Isn't that just, like, so fun?
My brain is melting.
Yeah, it hurts. I don't wanna, like, reference myself, but I did write a good, it's a review paper that is open access, it's online, it's through the Journal of Cannabis Research that I can send you a link to too.
Okay.
But
I'll
it
put it in the show.
basically compiles all the literature, and it's written in a pretty understandable way, and then has the links to all of the papers. So
Right.
instead of when people are like, "I do my own research," and researchers are kinda like,
Yeah.
uh, like, we do that. But for people who are doing their own research, I think it's so valuable to be like, here's the literature.
Right.
If you want to peruse it, like
Right.
here it is. It's some of them are written in a level that not a lot of people are going to understand. People with language barriers, like that's a whole other
Right.
loophole that things are not translated into other languages. But I do have a paper that kind of goes through the like why people are consuming, why OBGYNs are kind of scared to talk about it because they're not trained.
Yeah,
Like they're not
right.
trained in
And they don't
medical.
know really.
They
Yeah.
don't know unless they're spending all their time like
Right.
PubMed searching all of these potential articles. It's not like they're notified that a new
Yeah,
publication
right.
is put out. Um, and it kind of goes through like what the clinical data shows, what the preclinical data shows, and it's very much so written in a way that's like, here's your information. This is your pregnancy.
Yeah.
If you read these risks and the Zofran isn't working and the Unisom isn't working and all the stuff isn't working and you want to use CBD, go for it. Like that's your decision.
Right.
Be careful with cannabis because if you test positive, CPS can be called and it's like a whole thing. I'm less supportive of cannabis use as a whole.
Just
But
because of the
like
risk of CPS.
well, the cannabis data seems to have a lot more effects than the
Okay.
CBD stuff. Like the studies of THC alone are kind of more same effects but more severe.
Okay.
So it's not some I wouldn't like recommend cannabis use during pregnancy, but some people it's the same thing where like people are desperate to do what they need to do. So if it's like a recreational use, I'd highly recommend trying to cut it
Just like drinking.
if just like drinking. And there's
Right.
a lot of people argue like, well, cannabis isn't addictive. You can't be addicted to cannabis. And it's like you can be addicted to anything. Sugar. Like
Well, I
you
think
can be
even
addicted to
not
anything.
necessarily even like the drug of cannabis, but the act
The
of
act of it. And
smoking
there's
and like
so many
the
people
habits of waking up and doing it and like the spots in the day and whatever.
and the people you're with. There's
Yeah,
a
right.
huge amount of people who are not in the safest of relationships and their partner is very pressuring, or even if they're not explicitly pressuring, they're kind of implicitly pressuring
What about,
people to
is there
consume.
such thing as secondhand
Absolutely.
cannabis? Okay.
100. It's
Okay.
it's just like secondhand nicotine exposure.
Wild.
Secondhand cannabis exposure. Yeah. Which is also for people. So some of the public health work I do is in harm reduction for people who are using substances who are not at a point where they can stop. So there's people with substance use disorders, including cannabis use disorder, where it's like an actual dependency
Hmm.
on cannabis use, just like how an alcoholic would go into withdrawal from alcohol. Like it's a
Wow, really? I didn't know that that could happen with cannabis.
yeah, it can happen with
Anything.
so many things. Where
Caffeine.
instead
Do you know anything about caffeine during pregnancy? Because this wasn't
of
full. This full mason jar.
hey, the research has shown that the limit is actually pretty high to consume
Okay, great.
coffee. So, see, that's why we need to do the study. But a lot
Literally.
of the work we're doing right now, so for the people who can cut use, highly recommend cutting it, like providing the alternatives for nausea that have been rigorously studied to not have negative effects. The Zofran, the Unisom, the vitamin B6, like all of that stuff has been very rigorously studied. Whereas the cannabis stuff is so new and it's popping up with these risks that we're like, please go to the
Yeah.
ones. Um, but for people who can't stop or choose not to stop or whatever it may be, trying to educate them on harm reduction. So not smoking with the baby in the room, not smoking or doing edibles right before breastfeeding, right before it goes into your milk supply. Like consuming it after breastfeeding if you're
Okay, so
breastfeeding.
that's interesting because with alcohol,
The
and by
pumpkin thumb thing.
no, and I don't even know that I say they, and I don't think I mean scientists. They, as in the internet, probably recommend drinking.
Like as you're doing it.
Yes.
I've heard that. I've heard
Because
that.
because it doesn't go, it's like your blood. Like it takes a little while for it to get in
Because it's
the
water soluble.
okay. There you
Mhm.
go. Okay, so
And
that's what I was gonna ask you. This is me thinking that I'm a scientist. Are you ready?
you are. You're good. Everyone's a scientist in
Do
whatever thing they're interested in.
do female mice have more fat than male mice?
While pregnant and while breastfeeding,
No,
yes, because
babies.
they put on fat. They build fat while pregnant.
Okay.
I don't know. I'd have to check like baseline to baseline. I
Because
wouldn't be surprised.
well, I feel like that would be the fat storing in the females versus the fat storing in the males. Because adult, like humans, we are supposed to have like a higher fat
Yeah. For like
percentage
if you
that
get pregnant.
right. But
Yeah.
I'm just thinking, as your research companion here, I'm like, maybe because these maybe females
Have
have
fat,
more
they're fat.
fat that right.
I don't know. Maybe.
Bring it
It
to your
could be.
team and credit
I
me.
will. I will
Put
text
me in
Marie.
your research. Your research paper.
No,
Yeah.
it's really interesting. Because the weird thing with research is that you can kind of just like pick rabbit holes to go down, and you're like, this is my rabbit hole. So like my rabbit hole is CBD and pregnancy, and then there's other people whose rabbit holes are like the caffeine. Like we have people whose entire careers are dedicated to understanding caffeine and pregnancy,
Wild.
which is crazy.
But
And
so
then people
important.
get so annoyed when you go on the internet and there's people who are like, no, 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 it's fine. And you're like,
Yeah.
ah,
Yeah.
no. But yeah, so like some of the major harm reduction stuff for cannabis use at least is like washing your hands after using. So it's not on your hands, it's
Oh,
protecting your little
yeah.
baby.
Interesting.
Yeah, we're reducing as much as we can. Like even people who want to continue consuming during their pregnancies, trying to decrease the potency of the cannabis. Like if they can switch from a really high THC strain to a low THC strain, like they're still consuming, but it's less THC at least. So that's a win. Trying to consume a little less often. Like you can still consume, but reduce if possible. And then for those that are kind of postnatally, it's a lot of the like, please wash your hands, please be aware of secondhand smoke exposure, please be cognizant of breastfeeding, please be cognizant of having a sober caregiver. And a lot of
Right.
I explain to that is like a lot of people that I've worked with in the substance use world are like, well, it doesn't matter if I'm high while I'm at home. And I'm like, would you be okay if you hired a babysitter and they were high while taking care of your kid? And they're usually like, no. And I'm like,
I love your like realistic approach. You're like, I've done the
oh,
research. There's negative
there's risks.
effects. Right. There's risks. But also, I'm not blind to the fact that people are addicted, that people are in relationships with people that are doing that, that people are just going to choose to continue to do this. And so if that's your choice, here are
That's
other options. Like what you're saying, wash your hands, go in a different room, make sure that you have a sober caregiver. Like I appreciate that so much of just not being like, you need to stop. And if you
like, can you
don't,
just
you're a
quit?
terrible person. Right.
Like, have you ever told someone with a substance use disorder to just like, can you just like quit?
You should stop that.
No, and
Right.
also like with and like even compared to kind of a lot of people when they view substance use, they view this like 25 to 45-year-old male is like everyone's idea of like who has substance use disorders, but everyone completely neglects the history of moms having hidden substance use disorders, whether it's when we're prescribed benzos for like
Right.
multiple decades to like get through being a stay-at-home mom basically,
Yeah.
or the wine moms
Right.
who arguably probably are verging on the boundary of alcoholism,
Totally.
but it's like it's okay.
Normalized. Normalized.
It's totally
Yes.
normalized. And then there's also the whole physiologic component of like there is morning sickness, your hormones are changing, your moods are changing. A lot of people are using can in the surveys that are asking like pregnant people why they're using cannabis in general.
Yeah.
Vast majority up in like the 70 to 80% are saying nausea and vomiting. Makes sense. But
Mm.
also anxiety. It can in some people it increases anxiety, but a lot of people use it to decrease anxiety. Are using it as an anti-anxiety med, and they get so much flack for that. And I'm like, they're about to have a baby.
Yeah.
Like, wouldn't you be anxious? Like, isn't
Yeah.
that a normal response
Right.
to like growing and developing an entire human and then just having another human in your life that you have to take
Be
care of
responsible
and,
for?
like, pay for,
Right.
that makes sense to me that people are anxious,
Yeah.
and there's a lot of people, some that are very rightfully so, and some that are a little more, like, propaganda-y, but that are fearful of the pharmaceutical system, and they don't
Mhm.
like
Totally.
pharmaceuticals, and they want something that's natural, and
Yep.
they view even though it's probably produced in, like, the same factories, but it's bottled with, like, the cute little, like, green logo and, like, health food.
Yeah,
And you buy it at Whole Foods, and they're like, "This is safe and natural because it's a plant." And you're like, "Nicotine
totally.
comes from a plant, opioids come from a plant, like, lots of stuff comes from plants."
Hmm,
It
totally.
doesn't guarantee safety, but
Right,
I understand that people are like, "I don't wanna take Zofran. It's made in a pharmacy, like, this is a plant, and I want the plant." And I'm like, "Okay, that's your choice.
right,
Do what you need to do." Like, I don't recommend it, but
right.
I'm not gonna be like, you're an
I'm not gonna
unfit."
judge you. Yeah, exactly.
Like, you're doing what you need to do with the information that you have available, which is usually not very much, to try to not throw up all day.
Yeah,
And, like, I get it. No
totally.
one wants that.
So, in the most concise, what
Yes.
would you the use of from what you found in your research, the use of CBD can cause what are the negative? I mean, I know we've talked about this whole time, but I want like a
The
quick
brief one,
summary.
yeah.
Yeah.
From the research that we have done, consumption of CBD during pregnancy can affect the cognition of offspring, the neurodevelopment of offspring, and also the metabolism in offspring. So that glucose and insulin regulation, which can have lasting effects on how these offspring that are mice, take that with a grain of salt, perform cognitively, how they respond to food, and their activity later in life.
And would you blanket that for male and female? Or are you saying
The metabolism stuff, yes. The
okay?
cognitive stuff is we only saw it in females,
And
but
then,
other researchers have seen other things
oh,
in.
really? Okay, and males. And then what would you say? I guess could you do a summary on, I feel like it's kind of loaded, but either
Yeah.
cannabis or THC?
Mhm.
Like, can you do a similar thing from what you've seen from other people's research on?
Yeah. Yeah, absolutely. So from the cannabis research, which is a little more robust because it is both preclinical and clinical retrospective human studies, we see changes in anxiety of offspring, both males and females, in higher ADHD rates. And we're seeing changes also in metabolism when it comes to how much fat they put on their bodies, what their blood sugar is, um, and also their activity levels when they're exposed to cannabis,
They have more higher or lower activities.
lower activities.
Okay. And then
That's in
is
that
it the,
world.
sorry, what'd you say?
That's in that metabolic world when they
Oh,
have like
okay.
higher body fat, the resting blood glucose, all of that.
And then is that the same answer for THC specific?
That the clinical data is full cannabis product. The
Okay.
THC specific literature is very similar.
Okay. Woo!
I know.
So your scientific recommendation was to try to cut cannabis and CBD, but CBD you feel a little more comfortable with.
I think I would try to cut all of it if
Okay.
possible. But the risks of THC appear to be worse than the risks of CBD. It's the same thing, but just to a bit of a higher scale.
Got it.
So if people are really adamant about not stopping use or transitioning to one of the other alternatives for their nausea, vomiting, or anxiety, getting off of that high potency THC is a big one, decreasing the amount of consumption, like the volume of consumption, or the timing of consumption. If they can cut it from twice a day to once a day, if you can cut it from every day to every other day, like that's big. Um, and if you can cut like from THC to CBD, that's harm reduction. If you can cut from CBD to the Unisom and B6, like that's harm reduction. And also just really ensuring that harm reduction of trying to expose the baby as little as possible. So like the baby's already here for people who have already delivered.
Yeah.
Let's avoid second hits. Let's avoid smoking in the same room. Let's make sure we wash our hands after consuming. Let's make sure we have a sober caregiver. And getting help when you need help. Like there are huge support networks for people who have cannabis use disorders or for people who want to stop or who want to be in an environment that supports them when they're conflicted and they're like, I don't know how I feel, like I'd love to stop, but I feel very dependent on this. It makes me feel comfortable. So being able to talk to somebody in that situation without fear is a really big one. And there's large networks
Like
in
what?
so in Colorado, I work with this one organization called Hard Beauty. It's a group of people. I think other states have this as well, but they are women who had substance use disorders in their own prior pregnancies who are now in recovery and not using, and they work as peer support. So
Cool.
whenever pregnant patients come in and they report substance use in a hospital, we can refer them out to Hard Beauty and they can talk, and they do like support groups and yoga classes and like, all of that just gives these new moms some social support that can actually help them, because if you have your baby and then are left with no social supports, that's not going to deter you from using substance.
Totally. And I feel like instead of people who are like, well, I've never used, but I know that it is bad for you, versus
Exactly.
somebody who's like, yeah, I get
I
it.
was there.
Yeah. Yeah. Okay. So that's
That
great.
helps a
Hard
lot.
beauty. But what would you even Google if you were if you were in Minnesota and you didn't know about Hard Beauty in Colorado?
Probably, hmm, there's probably a few different ones. It could be like cannabis use support groups. It could be like peer support recovery is a big one. That's what they kind of advertise themselves under. Peer support is kind of like the general term for it's almost like comparative to doulas. I know that's a weird comparator to make, but it's like you just bring someone in who's been in the same situation at one point or another, and they're not a medical professional. They're not there
Right.
to medically guide you, but they're there to just be like, I've been here
Yeah.
really hard. This is what I did. Call me when you're struggling and
Cool.
I'll be there.
Sweet.
Yeah. So
Awesome.
peer support recovery services is a
Which
big
is
one.
so, I would never Google
It's a
peer
weird
support.
world.
Yeah. Well, like to your point of like what's on the internet, if I was struggling, I think I would, yeah, I don't even know, support group for cannabis moms or something, I don't know.
Yeah. And then you'll get the ones that are like, this
Yeah.
is the healthiest thing we've ever done. Come to our group. And you're like,
Right.
okay. But also like in the grand scheme of things, also like giving the kids who might be at risk for these cognitive delays, like early intervention.
Mm-hmm.
That's a big one. Like getting them the support they need as they go into school, making sure if maybe they're at risk, maybe you're finding this out and you're 3 kids down the line and you've been actively consuming cannabis this entire time and you're like, oh dear God, I didn't know any of this.
Right.
Like none of this is meant to shame those moms. It's more so just like your kids are at a higher risk for this, and this. Let's make sure they've got really healthy diets on board to see if we can decrease some of those metabolic effects. Like let's make sure that they're getting the early support intervention so that they can exceed in school.
Yeah.
Like there's a lot of things that we can do to mitigate prenatal exposures. The best, obviously, is avoiding the prenatal exposures, but it's not to say that, someone hears this and the intention is never to make them feel like guilty or remorseful or anything. It's like, okay, we are now empowered with the information that my kid might be at a higher risk for this, and this. Let's try to mitigate that
Yeah. Right.
as much as we can
Right. Yeah. You don't know what you don't know
until you know it.
until you know. Yeah. Okay. Fascinating. I'm so, so grateful that you took the time to chat with me. I love your approach to everything. I love the presentation. And yes, thank you so much for coming on and chatting with me about this.
Absolutely.
All right. I will talk to you soon.
Yeah.
All right. Thank you guys so much for listening. If you enjoyed it, please share with somebody you think would love. And I would be so honored if you would subscribe to the podcast and leave a comment and rating below so I can know what you guys are digging, what you want more of, just connect with you a little better. Thank you so much for listening, and I'll see you next time.